A group of nurses from more than a dozen facilities in the city are expected to walk out and picket today in protest. This comes after a report showing poor conditions and chronic understaffing. The report is compiled with nearly 2,500 complaints filed by nurses, and it highlights problems at private hospitals like New York Presbyterian, Mount Sinai, and Montefiore Medical Center's Moses Wheeler campuses. Joining me to talk about this is Judy Sheridan-Gonzalez. She's the president of the New York State Nurses Association. It has 42,000 members. So first of all, good morning and thanks for joining us.
Good morning.
I see the protesters. I hear the protesters behind you.
It's very noisy here, as you can see.
Yeah, I can. Tell us about today's protest. What are you trying to communicate and achieve?
Sure. Today we're out here fighting for our patients, fighting for our community, fighting for quality health care for the Bronx and for all of New York City, and really fighting to salvage nursing practice and the future of health care in America. Many of our nurses are caring for far too many patients. It's not safe. It's really dangerous. We have documents and reports that with thousands of complaints and thousands of protests of our nurses saying that the patient load is much too high. We're in contract negotiations fighting for safe patient ratios. It's something like class size, or, for example, in a daycare center, how many adults are needed to care for a certain number of children. For us, it's a matter of life and death. We know that if we take care of too many patients, we're not giving the quality care that our patients need. And our patients in the Bronx, we believe that they deserve the best care possible, that every patient, as you can hear, is a VIP.
Understaffing at hospitals, this isn't a new subject. It's been debated for years. There was a debate in Albany, but the bill never came to a vote in the legislature. Is there something this year that's different that you think can move this forward?
Well, we actually have two avenues to get safe staffing this year, one through the Department of Health, through an initiative, and of course there's our bill. And also in our own contractual battles, we're fighting, particularly in these well-funded academic medical centers where we think the battle can start to be able to take care of our patients properly. All the data, all the research, everything that we know proves that patients survive better. For example, the Institute of Medicine put out a report about 10 or 15 years ago that there are nearly 500,000 reported deaths due to errors in our hospitals. That was 15 years ago, and that's also underreported. They believe the figures are probably 10 times that high, so you can do the math. We know that there's really serious outcomes when there are errors, and nurses are the mitigators of these errors. In addition, as nurses, our patients are really sick, and we don't have the time to not only take care of them properly, but to do things like, for example, comfort a patient who's dying, or deal with a family member with a terrible illness, to give the TLC that people need, or even to medicate them properly and timely, and do the things that patients need, have a nurse take care of them.
All right. And just quickly, the protest with so many nurses walking off the job today, is that going to affect care for people in these hospitals and medical facilities today?
No, today is an informational picket. Everybody's out here on their break or on their off time. All the nurses you see out here are not being paid right now. They're not supposed to be working. They're off. They're off duty.
Judy Sheridan-Gonzalez.
These are mostly night nurses.
Okay. We appreciate your time this morning, and thanks for bringing that news.